How long do prednisone side effects last? Important question if you're prescribed prednisone and you want to know, when is this going to stop making me feel miserable? I had to take prednisone for 9 months, and it was one of the most horrific experiences of my life. At that time, I had no idea how long I would be on it, or when it would finally end, or when I would finally stop feeling these side effects. Asking this question makes perfect sense. So I want to give you some reassurance and some mindset to how to deal with this, because as much as it is a physical experience you're undergoing, it's also a little bit of a psychological experience of not psyching yourself out. So before I get into the actual details of what you're going to experience potentially while taking prednisone, I wanted to help with that mindset. And this comes from an amazing book called Good to Great by Jim Collins. He talks about how businesses succeed and fail, how they can become great companies. And he tells the story of Admiral Stockdale. That means he was like one of the leaders in the Navy during World War II. He was imprisoned in a Japanese prisoner of war camp and tortured 20 times. He went through a horrific experience and even disfigured his own face so he wouldn't look like a healthy prisoner when he was being interviewed for television. So he was interviewed by Jim Collins, and what he said reminded me so much of taking prednisone, because I feel that one of the words that the transcriptions of my videos often thinks that prednisone is prisoner. Prednisone, prisoner. And so I feel like taking prednisone is not in any way being a prisoner of war, but it is a prisoner of this pill. So I wanted to use his perspective to help us understand how to survive this special kind of torture we undergo. So he said, Stockdale was limping and arc-swinging his stiff leg that had never fully recovered from repeated torture. Finally, after about 100 meters of silence, I asked, who didn't make it out of the prisoner of war camp? Oh, that's easy, he said. The Optimists. The Optimists? I don't understand, I said, now completely confused, given what he'd said 100 meters earlier. The Optimists. Oh, they were the ones who said, we're gonna be out by Christmas. And Christmas would come, and Christmas would go. Then they'd say, we're going to be out by Easter. And Easter would come, and Easter would go. And then Thanksgiving. And then it would be Christmas again. And they died of a broken heart. Another long pause and more walking. Then he turned to me and said, this is a very important lesson. You must never confuse faith that you will prevail in the end, which you can never afford to lose. With the discipline to confront the most brutal facts of your current reality, whatever they might be. To this day, I carry a mental image of Stockdale admonishing the Optimists, we're not getting out by Christmas. Deal with it. So I feel that prednisone is like being in a prisoner of war camp. You might be stuck in there for the rest of your life. You might be released early. You don't know when. You don't know when the side effects are going to stop. You don't know when you're going to be able to stop taking the medication for a lot of people. Some people do. But if you want to know when the side effects are going to stop, how long do they last? Let's get into some of the worst side effects, the ones I'm often asked questions about, and we'll go through those. In general, the principle is that how long the side effects last depends on several things. It depends on your dose, because the higher the dose, the worse the side effects. The duration, how long you take the prednisone, because some of those side effects can be permanent. And then your DNA, who you are, because prednisone is affecting up to 2/3 of your DNA. The three most common questions I get, the most heartfelt, anguished, help me questions are, when is this anxiety going to go away? This often happens when somebody takes prednisone or another similar drug like methylprednisolone or dexamethasone at a pretty high dose for a short-term amount of time. And then it suddenly causes disabling, miserable anxiety. Person was otherwise mentally healthy and then suddenly cannot even handle watching TV, leaving their house, or doing anything. Everything is just too overstimulating and it causing anxiety. Other mental health side effects include paranoia, emotional disturbances, psychosis, depression. Basically, any mental condition can be worsened by prednisone or can appear because of prednisone. And typically, for most of these, the higher the dose, the worse the side effect. So as you come down in dose, it usually goes away. And for that first one I was talking about, that anxiety, it can affect you even after prednisone is stopped. And it usually goes away in about 3 weeks, sometimes about 3 months. I've heard from other people that it's been a year. It's really individual. It's really that DNA that I was talking about that is the deciding factor of when it goes away. But typically with most mental health side effects, it goes down as the dose goes down and it disappears as the dose is gone. That's how most of them work. But what I want you to remember when it comes to prednisone and the mood changes it can inflict upon us is it's not you. It's the drug. This is a side effect. You are not crazy. The drug is doing something to you. It feels like psychological torture, right? Because it basically is. Prednisone is its own special kind of torture. Okay, the second type of side effect people want to understand is, when is my adrenal system going to recover? So prednisone is affecting the hypothalamic pituitary adrenal axis, your stress hormone axis, your cortisol releasing system, the HPA axis. And this system works by sending messages back to tell the next person to do their job. And this message is not being sent back. The messenger is not being sent. So you essentially are turning off your ability to make cortisol. And it takes a while to turn back on. It's not a light switch that suddenly you stop taking prednisone and it turns back on. It's more like a sunrise that it slowly gets brighter and brighter and brighter and brighter as time goes on. And for every person, the DNA is really important to take into account here, and how long you took it. If you only take prednisone for between 5 to 10 days, chances are this happens a lot faster than if you take prednisone for 5 to 10 months or even years. It's going to take longer to recover. One person had the adage that however long you took the prednisone is how long it's going to take to recover. I don't fully agree with that, because I know there are some people who could take prednisone for a whole year and within a week their adrenal system can turn back on. Others can take prednisone for a whole year and may never recover, and that's called adrenal insufficiency. It just takes too long or doesn't ever turn back on. And essentially, your body has lost the ability to make cortisol on its own. And for those 1 to 10%, we don't even really know how many people, you cannot make cortisol. And so you have to replace it by continuing to take prednisone or hydrocortisone or another steroid, basically for the rest of your life, unfortunately. And then there's a related thing, and that's withdrawal. So if you taper too quickly off of prednisone, then you might get withdrawal symptoms. Just like if you were to be an alcoholic and suddenly go cold turkey off of alcohol, you'd go through alcohol withdrawal, right? Your body has gotten used to being on prednisone. And so going off of it causes withdrawal symptoms such as joint pain, dramatic fatigue, achiness, basically flu-like symptoms. And it can be hard to differentiate that between being actually ill. So you have to talk to your doctor. But if you do, then you need to go back on the lowest effective dose, wherever you weren't feeling that yucky feeling. And then the third type of question I often get is, when will my moon face go away? And related, when will this weight gain stop, or when will I lose the weight that prednisone made me gain? And these are definitely related to the 3Ds: the dose, duration, and your DNA. The dose is the most important. The higher the dose, the worse the moon face, the rounder the face. Typically at 60 milligrams of prednisone, most people are getting moon face. Whereas at 6 milligrams of prednisone, it's a lot less common to have moon face. But If you've been on prednisone for a long time, it's more likely to have moon face, even if you're at a lower dose, say between 10 to 15 milligrams. So it's a combination of the dose and the duration, essentially the amount of milligrams you're exposed to over time. And then your DNA. Typically, moon face is worse for women who are younger and those who are on a higher dose. And so it's not fair that typically the people who need prednisone are often women. So we're getting moon face more likely than men. But it definitely still happens to men. And then the weight gain. Unfortunately, the weight gain, like my doctor told me, is real. And it's not like having a baby and suddenly you stop taking prednisone or you give birth to the baby and then the weight just disappears. It's not like that. It's real weight gain, unless it's water weight gain. And that is a little easier to lose because prednisone messes with your water and kidney metabolism. And so once the kidneys kick back in, you lose that water weight. But the fat redistribution, the belly, takes a little longer to lose, unfortunately. And every person's different, and you got to do what it takes for you to lose weight, whether that's keto diet, intermittent fasting, a whole food plant-based diet, whatever works for you, or as the doctors at the Harvard Medical School seminar I attended suggested, GLP-1 agonists like Wegovy and Zepbound are appropriate to help you lose your prednisone weight gain. They are okay to take alongside prednisone or after taking prednisone. So which side effects don't go away? These include anything that causes permanent damage. So heart disease, the changes, if you got heart disease progression, for example, you had a stroke, that damage is permanent. You had a heart attack, that damage is permanent. You had an arrhythmia start. Maybe it's going to have less, but the damage, the progression of heart disease doesn't just go away. If you got high blood pressure while on prednisone, that goes away once you stop taking it. But the damage from the high blood pressure and high cholesterol caused by the prednisone, that is irreversible. It's damage. Then your bones. Prednisone is causing osteoporosis and other bone loss, and that is irreversible. The loss of those nutrients from your bones just doesn't come back. You need to be taking precautions while on prednisone to minimize the loss. And then your eyes. If the high blood pressure inside your eye, called glaucoma, leads to eye damage, like optic nerve damage leading to blindness, that's irreversible. There's nothing you can do about it. If prednisone causes cataracts, like clouding of your lenses, that's permanent. You can get a lens replacement, cataract surgery, but the damage is done. Like there's nothing you can do about it. And finally, I wanted to conclude with some of Admiral Stockdale's words of wisdom for how to deal with the torture that is being on prednisone. And this is what Jim Collins said. How did he actually deal with this? He said, "I never lost faith in the story," he said when I asked him. "I never doubted not only that I would get out, but also that I would prevail in the end and turn the experience into the defining event of my life," which, in retrospect, I would not trade. I feel the same way about my disease, that it was terrible. It was scary. It was miserable having this disease and having to take prednisone for it, thinking I might die and leave my children motherless. But it has turned into the defining event of my life. I have helped millions of people taking prednisone now through this YouTube channel and my blog. And it can be that way for you too. If you're having to take prednisone, let this turn into the defining event of your life that you would not trade. Help others who are going through hard things because of what you learned while taking prednisone. I hope this helps you to overcome that psychological battle that you have to deal with when you're taking prednisone. So what can you do? Well, the doctors who prescribe prednisone the most, the rheumatologists, are worried about this, and they actually created a guideline to help all of the doctors know how to help their patients like you and me. And their guideline is called Glucocorticoid-Induced Osteoporosis Guideline, created by the American College of Rheumatology. And in it, they recommend several things to, for example, help prevent osteoporosis from leading to broken bones. First, they recommend quitting smoking. Second, eating a diet that is rich in calcium and vitamin D. Third, supplementing calcium and vitamin D if you can't, and measuring your vitamin D to make sure it's in the appropriate range. Fourth, quitting alcohol, because both smoking and alcohol can worsen the bone loss caused by prednisone. So those are some things that you can do to minimize the complications from prednisone. I was personally worried about this when I was taking prednisone. I was so worried that with my family history of osteoporosis, that I was going to turn into my little grandma who'd shrunk in height. And I didn't want that. And so I did something that I never thought I would do when I was in pharmacy school, because in pharmacy school, they told us that dietary supplements are a huge waste of money and you might as well just flush the money down the toilet that you spend on it for the good it will do. Then I had to take prednisone. And I realized that if the doctors who prescribe prednisone the most have all of these studies supporting the need for calcium and vitamin D supplementation, then we really need it. And then I found out that it wasn't just calcium and vitamin D that prednisone's stealing, it's also other nutrients like chromium. That's what's leading to the blood sugar changes that can lead to diabetes and other complications of diabetes like blindness and heart disease. And I was mind blown when I read a study that said taking chromium picolinate can reverse diabetes caused by prednisone. It was so stunning that at least those three nutrients plus others are being stolen by prednisone, leading to this damage. And so some things that you can do to minimize how long the side effects are going to last and potentially minimize how permanent and irreversible they are is supplementing the nutrients that prednisone is stealing. And so I invented Nutrinized Zone, the first and only supplement for people on prednisone. It comes in a morning and a bedtime bottle, so it has enough calcium, vitamin E, chromium, and other nutrients to support you, to give back the nutrients prednisone steals. The morning bottle also helps support your metabolism, and the bedtime bottle also helps support your sleep by giving back the nutrients that prednisone steals that makes it hard for you to get restful sleep. So you can just go to Nutrinize.com to get Nutrinize today to help you feel like yourself again while taking prednisone. Signing off as Dr. Megan, your prednisone pharmacist.